Welcome, everyone, to another episode of the IQ Podcast, where you can gain insights into your vision health and your brain health and raise your IQ. I'm your host, Dr. Banik. This week, we're going to be doing something a little bit different on the IQ Podcast. Instead of me being your host on the podcast, I've invited two of my friends who are amazing podcasters themselves, Mark and Christine, who are the hosts of the Health Compass podcast. So they're going to be doing a week-long takeover of my podcast, and they're going to be talking about an ebook that I wrote called 5 Visual Symptoms of Migraine. So in this podcast, they're going to be sharing some really interesting information from that ebook. So I really hope you enjoy this week's episode of the IQ Podcast with guest hosts Mark and Christine.
Ever get that weird shimmering in your vision, like a heat wave, and think, ugh, is this a migraine coming on?
Oh, tell me about it.
Well, you are in the right place because today we're diving deep into all those weird visual disturbances that can come with migraines.
We're going way beyond just the headache itself.
Way beyond. And to guide us on this journey into the often overlooked world of migraine visual symptoms, we have an amazing expert, Dr. Rani Banik.
She is double board certified in neurology and ophthalmology, so she knows this stuff inside and out.
And get this, she actually experiences migraines herself.
So she gets it. She understands the science, but also what it actually feels like.
Exactly. And thankfully for us, she's put all that knowledge into her guide, Eye on Migraine, where she breaks down 5 visual symptoms that you might not even realize are connected to migraines.
5. It's amazing how many people think migraine is just a bad headache when it can be so much more than that.
Right. And just to get us all on the same page, migraines are neurological, right? They're happening in our brains.
Absolutely.
But what always blows my mind is that there are over 40 different symptoms linked to migraines.
It's true, and a lot of them are visual. You know, we hear the term ocular migraine a lot, but that's kind of misleading.
Really?
Yeah, it's not really about your eyes themselves. Most of these visual disturbances are actually originating in the brain, specifically an area called the visual cortex.
So it's our brain, not our eyes, that are playing tricks on us.
Exactly.
Which brings us to visual auras.
Oh, yeah. Those weird, almost hallucinatory experiences some people get right before a migraine hits.
Like flashing lights or zigzags.
Yes. Or blind spots, even temporary vision loss. It's all connected to auras.
It's like your brain is projecting a light show on the inside of your eyelids.
That's one way to put it. And here's something that might surprise you. It actually affects both eyes at the same time.
Wait, really? Even if it seems like it's just one eye?
Exactly. It's what we call a bilateral phenomenon. Even if the visual disturbance only seems to be happening on one side, both sides of your brain are actually involved.
Wow, I never knew that. So next time I have an aura, I'm going to close one eye at a time and see what happens.
You should. It's a good way to remind yourself just how powerful and strange our brains really are.
So what's actually going on up there during an aura? Is it like a neurological storm or something?
Kind of. Dr. Banik describes it as this wave of electrical activity that surges across the visual cortex like a ripple effect.
Instead of water, it's neurons firing like crazy.
Exactly. And this wave is then followed by a period of reduced activity in those same neurons, almost like a neurological dip.
So it's like a brain roller coaster. And those ups and downs are what's causing all those crazy visual disturbances we experience as an aura.
Precisely. And here's an interesting twist: that headache pain. It often starts on the opposite side of your head from where you saw the visual aura.
No way, really. The brain is so weird. Okay, well, before we get too lost in the weird and wonderful world of the brain, let's break down Dr. Banik's 5 key visual symptoms.
It's good to me.
And since we've already dipped our toes into the world of visual auras, let's start there.
She gives a really vivid description of the typical aura experience. You know, things like those zigzag patterns, those colorful flashing lights.
I've even heard people describe it as seeing a C-shaped pattern that has blurry vision right in the center of the C.
Yeah, that's common too. It's almost artistic in a way, isn't it? Like you're looking through a kaleidoscope or seeing heat waves.
Yeah, except I don't think I'm usually in the mood to appreciate the art when I'm also dealing with a migraine.
Right. It's less, ooh, pretty colors, and more, oh no, here we go again.
Exactly.
Yeah.
But I'm guessing there's a scientific reason why those specific visuals happen. It's not just random, right?
You are correct. It all goes back to how that wave of electrical activity we talked about spreads across the visual cortex. You see, different areas of our visual cortex correspond to different parts of our visual field.
So as the wave moves across the cortex, it creates these very specific visual patterns.
like a domino effect of neurons firing across your brain.
That makes a lot more sense.
And you know what? Dr. Banik actually links to this really interesting video from the Mayo Clinic in her guide that shows what visual auras look like in action.
Oh, that's really helpful. We should include that link in the show notes for this episode so everyone can check it out.
Absolutely.
Okay, moving on to our second visual symptom. And this is one I think a lot of us can relate to: light sensitivity, or, as the doctors like to say, photophobia.
Oh, yeah. This one is no joke. It can be truly debilitating during a migraine. Some people have to retreat to a dark room for hours, even days, just to escape the pain of light.
I've been there. Sunglasses on, lights off, phone brightness as low as it can go. But I think it's easy to forget that this intense light sensitivity isn't just in our heads. It's literally about how our brain is processing those light signals.
Exactly. There are actual changes happening in the brain. Certain brain areas become super sensitive to light, hypersensitive during a migraine.
So even normal levels of light that wouldn't bother us on a normal day can feel super intense, even painful.
Yes. And to make things worse, there's this really strong link between migraines and dry eye.
Right, I've heard that.
And of course, dry eye can make light sensitivity even worse.
It's like a double whammy. You're already dealing with a migraine, and now your eyes are screaming at you too.
Which is why it's so important to manage both conditions. If you can address the dryness and irritation in your eyes, you can significantly improve that light sensitivity.
So it's a two birds, one stone situation.
Exactly. Okay, the third visual symptom on our list is something called ocular migraine, sometimes called retinal migraine.
And this one sounds a little scarier.
It can be alarming because unlike auras, which affect both eyes, ocular migraine usually only affects one eye at a time.
Okay, so what's the difference between this and a regular visual aura? They both sound pretty similar.
Well, with ocular migraine, you're going to have those same visual disturbances, like those flashing lights, blind spots, or even temporary vision loss. But it's only going to be happening in one eye.
Got it.
Dr. Banik mentions that people often describe it as seeing stars, darkening, or even this feeling of their vision closing in, like tunnel vision.
Yeah, those are definitely not words you want to hear when it comes to your vision.
No, not at all. But it's important to remember that even though ocular migraine can be frightening, the episodes themselves are usually short-lived. They might last for a few minutes to an hour and then they disappear.
Okay, that's reassuring. So what is it about ocular migraine that's causing these sudden vision changes in just one eye? Is it happening in the brain too?
Good question. Unlike the visual aura, which we know originates in the brain's visual cortex, ocular migraine is thought to be caused by problems with blood flow to the retina of the eye.
So the retina being that thin layer at the back of the eye that's basically like the projector screen for our brain, right?
Exactly. Your retina is full of these light-sensitive cells that capture images and send those signals to your brain.
So if those cells aren't getting enough blood flow, they're not going to function properly.
Exactly.
And that's where those visual disturbances come in. Can you treat that, or is it more of a, this is happening, we just have to wait for it to stop type of thing?
That's where seeing a specialist is so important. If you experience this type of sudden vision change, especially if it's in just one eye, get to an ophthalmologist or a neuro-ophthalmologist as soon as you can.
They can make sure it's not something more serious, right?
Exactly. While ocular migraine itself is usually harmless and temporary, those same symptoms could also be a sign of something more serious going on, like retinal detachment, which can lead to permanent vision loss, or even a stroke.
Okay, yeah. That's definitely not worth messing around with. Always better to be safe than sorry, especially when it comes to your vision.
Absolutely. Early diagnosis and treatment are key.
Okay, so we've covered visual auras, light sensitivity, and ocular migraine. That brings us to number 4 on our list of visual symptoms, and I'm just going to say it. This one is a mouthful: benign, episodic pupillary mydriasis.
I know, right? It sounds way more intimidating than it actually is.
So break it down for us. What is this benign, episodic, whatchamacallite?
Okay, so essentially, it's when one or both of your pupils temporarily dilate, often during or around the same time as a migraine. You might also notice a visible size difference between your two pupils. You might experience some blurred vision and increased sensitivity to light.
Okay, so to put it in plain English, our pupils, the black part in the center of our eyes, get bigger than usual.
Yes, precisely.
And it's all because migraines can sometimes mess with our autonomic nervous system, right?
You got it.
Okay, hold on. Pause right there. Can we do a quick refresher on what the autonomic nervous system is and why we care, especially when it comes to migraines?
Yeah, of course. Basically, Your autonomic nervous system is your body's autopilot. It's the control center for all those automatic functions that we don't have to consciously think about, like breathing, heart rate, digestion.
Keeps everything running behind the scenes.
Exactly. And yes, it also controls our pupil size. So when we get a migraine, those carefully orchestrated signals from our autonomic nervous system can get disrupted, which can lead to those temporary pupil changes.
That makes a lot of sense.
It can be a little freaky to experience, but in most cases, it's totally harmless.
So if your pupils decide to do their own thing during a migraine, don't panic. It's probably just this benign episodic, what was it again?
Mydriasis.
Mydriasis, yes.
Yeah.
See, I'm learning. But, and there's always a but, right?
There is. It's important to know when those dilated pupils could actually be a sign of something more serious. Dr. Banik lists out a few red flags in her guide, and basically she says, if you have a dilated pupil along with any of these symptoms, you need to get to a doctor immediately. We're talking a drooping eyelid, double vision, difficulty moving your eyes, any kind of neck pain, or any vision loss at all.
So it's about trusting your gut. If something feels off, don't ignore it. Get it checked out.
Exactly.
Okay, we are on to the fifth and final visual symptom Dr. Banik covers in her guide. And this one sounds intense, even compared to some of the others we've talked about today. Ophthalmoplegic migraine.
And this one is definitely rare and complex.
Rare and complex are two words I don't love hearing, especially when it comes to my health. So what makes this type of migraine so different from the others?
This one specifically involves the muscles that control your eye movements. Essentially, this type of migraine zeroes in on those muscles and causes temporary paralysis or weakness.
Oh, wow. So you might not be able to move your eye properly.
Yes, and this can cause all sorts of visual disturbances like double vision, a drooping eyelid, eye pain, and difficulty moving your eyes in certain directions. And unlike a typical migraine, which might last for a few hours or maybe a day or so, ophthalmoplegic migraine can stick around for days, even weeks at a time.
Weeks. That's brutal.
It's a tough one to deal with for sure. And the headache pain that goes with it is often described as severe, typically concentrated around the eye or the temple.
I'm wincing just thinking about that.
It's not pleasant.
So with all those intense symptoms, what's actually going on? Is this a blood flow thing too, like ocular migraine?
That's a great question. It's not totally clear yet, but the leading theory is that it involves either inflammation or compression of one of the cranial nerves, the oculomotor nerve.
Okay, another anatomy lesson. What's so important about this oculomotor nerve?
Well, this particular nerve is basically the control center for most of your eye movements. So it's responsible for things like being able to move your eye up and down, inward. It even helps control your pupil size.
So when it's inflamed or compressed, like an ophthalmoplegic migraine, it throws a wrench into your eye movements,
Yeah.
and that impacts your vision.
Exactly.
It's like someone cut the power line to your eye's control panel.
That's a great way to put it. And because there is the potential for serious complications if it's not addressed, Dr. Banik stresses that it's so important to seek immediate medical attention if you have any symptoms of ophthalmoplegic migraine.
So don't wait that one out. Definitely get to a doctor right away.
Absolutely. Early diagnosis and treatment are key.
So we've covered those 5 key visual symptoms that Dr. Banik talks about in her guide.
And luckily, it's not all doom and gloom. She actually gives us some really practical advice on what to do about all of these visual symptoms.
Okay, good. Because I was starting to think, well, this is all very interesting, but what am I supposed to do about any of this?
Right. Knowledge is power, but only if you can actually use it.
Exactly. So let's talk about some management techniques, starting with those visual auras. I mean, when those zigzagging lights come marching in, is there really anything you can do besides just ride it out?
Well, as with most things in life, sometimes the simplest answer is the best one. When an aura hits, often the first and best line of defense is just to rest.
Okay, so find a dark room, close your eyes, wait for it to pass.
Exactly. Try to find a dark, quiet place. Lie down if you can, close your eyes, and just let it run its course. Give your brain a time out. And while you're resting, it's a good time to think about those potential triggers.
Like what caused this in the first place?
Exactly. Dr. Banik gives this great list of common culprits, things like stress, dehydration, bright or flashing lights, certain foods, lack of sleep.
It's like playing migraine detective.
Yeah.
You have to gather the clues and see if you can figure out who the culprit is.
It really is. And getting those triggers under control can be a huge game changer in reducing how often you get those auras and how bad they are.
That makes sense.
And of course, medication can be really helpful too.
Oh, yeah, for sure. Especially if you can take it early enough.
Right. If you can catch it at the very beginning, sometimes it can even stop the aura in its tracks.
That would be amazing.
Mm.
Okay, so pay attention to your body, learn your triggers, and if you need medication, don't wait.
Exactly.
Okay, now what about light sensitivity? That one's a tough one because, I mean, the world is a bright place. We can't exactly walk around with our eyes closed all the time.
No, we can't. So this one is all about minimizing your exposure as much as possible and protecting your eyes. Dr. Banik is a huge fan of sunglasses.
Oh yeah, sunglasses for sure. Although I will say I've definitely been guilty of grabbing those cheap, flimsy ones from the drugstore.
Well, she makes a really good point about investing in a good pair that actually blocks 100% of UV rays.
Okay, so those flimsy fashion sunglasses aren't going to cut it.
Probably not. You really want something that's going to give you that full protection. And she even mentions those migraine glasses that have FL41 lenses. Have you heard of those?
I have, but I don't know much about them.
So those are specifically designed to filter out certain wavelengths of light that are known migraine triggers.
So it's like noise-canceling headphones, but for your eyes.
Exactly. They help to create a more migraine-friendly visual environment. And beyond sunglasses, even just making a few adjustments to your environment can make a big difference.
Well, like what kind of adjustments?
Well, using dimmer switches on your lights, investing in some blackout curtains, maybe even swapping out those harsh overhead lights for softer lamps.
Okay, so it's all about creating a more soothing visual space, especially during a migraine attack.
Exactly. And since we're talking about visual overload, we can't forget about our screens.
Oh my gosh, the screens, our phones, our computers, our tablets, it's like we're constantly bombarding our eyes with blue light.
And Dr. Banik addresses that directly. She actually recommends those blue light filters, both the physical screen protectors and also those blue light settings that you can use on your devices.
Yeah, I've been trying to use those blue light filtering apps more often, especially at night.
It really does make a difference.
Yeah, I think it helps. At least my eyes don't feel as strained.
It's those small changes that can really add up. And, we talked earlier about how dry eye can make that light sensitivity so much worse.
Oh, for sure.
So keeping your eyes lubricated with artificial tears can be really helpful.
Definitely. And of course, staying hydrated by drinking plenty of water is essential too.
Absolutely. Okay, let's shift gears a bit and talk about ocular migraine. We've already established that seeing a specialist is really important if you experience those sudden vision changes, especially in just one eye. But in the moment, what can you do to manage those symptoms? Because, let's be real, they can be pretty scary.
Yeah, it's not fun when you feel like your vision is going haywire.
No, not at all. And unfortunately, a lot of the same advice applies here. Rest is key.
So find that dark, quiet room again.
Exactly. Close your eyes, relax your body, and just try to ride it out. I know that's easier said than done when you're in that moment and you're thinking, oh my God, am I going blind?
Right, but panicking is only going to make things worse.
Exactly.
Okay, what about benign episodic pupillary mydriasis? Any special tips for that one, or is it mostly a wait-and-see kind of thing?
It often is about waiting it out, but you can make yourself more comfortable while you do. Since light sensitivity is a common symptom when your pupils are dilated, Dr. Banik recommends wearing sunglasses.
Even if you're inside?
Even if you're inside, your pupils are wide open, so they're letting in way more light than usual, which can feel really intense.
Yeah, that makes sense. Just block it all out. Okay, what about keeping a migraine diary? Is that something that's helpful for this particular symptom?
It can be. It's always good to track those episodes, make a note of when they happen, how long they last, and if you're having any other migraine symptoms at the same time. That can really help you to identify any patterns or potential triggers. And of course, if it's happening a lot or if you're ever worried, don't hesitate to talk to your doctor.
Right. Always better to be safe than sorry.
Okay, we have one more visual symptom to cover ophthalmoplegic migraine. What can you do when you literally can't move your eye properly?
So, as we already discussed, with this type of migraine, it's really important to get to a doctor as soon as possible.
Because it could be a sign of something more serious.
Exactly.
Okay, so what about managing the symptoms, which I'm guessing are pretty terrible?
Yes. Unfortunately, with this type of migraine, the headache, pain can be really severe, so pain management is key.
Okay, so pain relievers for sure.
Definitely. And your doctor might even prescribe something stronger, like corticosteroids.
To help with the pain? Well, they help with the inflammation. Remember we were talking about how ophthalmoplegic migraine is thought to be caused by inflammation of the oculomotor nerve. So those corticosteroids can help to reduce that inflammation and hopefully speed up recovery.
Okay, that makes sense.
And in some cases, your doctor might recommend preventative treatments to try to reduce how often you get these migraines or how bad they are.
Like what kind of preventative treatments?
It really depends on the individual and what other health conditions they might have. But it could include things like beta blockers, calcium channel blockers, or even anti-seizure medications.
So it's really about finding the right combination of treatments that work for your unique situation.
Precisely. And beyond medication, rest is so important.
Of course.
Give your body time to heal. Reduce any unnecessary visual strain by avoiding things like reading or staring at screens for too long. Let those eye muscles relax and recover.
Okay, so we're back to giving our eyes a break.
It makes a difference. And this is probably going to sound really obvious, but it's worth repeating because so many of us don't do it. Prioritizing a healthy lifestyle can make a huge difference.
You're talking diet, exercise, sleep, all that good stuff.
All of the above. It really does lay the foundation for a healthier brain and body, which in turn can make you less susceptible to those debilitating migraine attacks.
It's like building a fortress of wellness to protect yourself from those migraine attacks.
I love that. Building a fortress of wellness. That's exactly what we're talking about. And speaking of building a fortress of wellness, there's something else I wanted to mention that Dr. Banik talks about in her guide.
Okay, what's that?
She's a big proponent of this holistic approach to migraine management.
Okay, so thinking beyond just medication and really looking at those lifestyle factors we were just talking about.
Exactly, like what we're eating, how we're managing stress, how well we're sleeping. And she even mentions that certain supplements might be helpful. She actually has something called a migraine bundle.
Yeah, I was wondering about that. So what's the deal with supplements for migraines? Are they legit or are they just hype?
That is the million-dollar question, isn't it? I always think it's important to approach supplements with a healthy dose of skepticism. And before you add anything new to your routine, talk to your doctor.
Of course.
But that being said, there is growing evidence that certain nutrients can be really helpful in managing migraine.
Like magnesium, right? I've heard good things about magnesium.
Yeah. Yes. Magnesium is a big one. And riboflavin,
Okay, yeah.
omega-3 fatty acids.
Right.
There's actually a whole bunch of them.
And it seems like Dr. Banik's migraine bundle has a combination of a few of those,
Yeah.
like magnesium, riboflavin, omega-3s.
Exactly. It has a few other things in there too, like some botanicals, antioxidants.
And I like that she's really transparent about the fact that these are supplements that she takes herself and that she recommends to her patients.
Yes. It definitely doesn't feel gimmicky at all.
No, it feels very authentic, which I appreciate.
But it is important to remember that supplements aren't a magic cure-all.
Right. If only it were that easy.
Right. They're just one piece of the puzzle.
They can support all those other lifestyle changes and treatments that you're already doing. It's about taking control of your health and being proactive, not reactive, when it comes to managing your migraines.
I love that. Taking control.
Right. It's so easy to feel helpless when those weird visual things start happening. Okay, so we've covered a ton of ground today, from those bizarre zigzagging auras to light sensitivity to that really intense one, the ophthalmoplegic migraine.
I know. It's a lot to process.
It is. But if there's just one thing I hope you take away from all of this, it's that migraine is so much more than just a headache, you know?
Right.
It's this whole complex neurological experience, and those visual symptoms really highlight that connection between our brain and our eyes.
And how even the tiniest disruption in that delicate system can really mess with our perception of the world around us.
Exactly. It's amazing how much we take our vision for granted until something goes wrong.
I know. And that's why I think what Dr. Banik is doing is so important. She's really helping to educate people about these often overlooked migraine symptoms.
Right. We need more of that.
Yes, we need to get people talking about this more openly so they can get the support and treatment they need.
Absolutely. And speaking of treatment, I wanted to circle back to something Dr. Banik emphasizes throughout her guide, which is this idea of a holistic approach to migraine management.
Oh, yeah, she's a big believer in that.
So looking beyond just medication and really thinking about those lifestyle factors that we've talked about.
Like what we eat, how we manage our stress levels, how much sleep we're getting, all of those basic things that we often neglect.
Which, let's be honest, are so much easier said than done. Like, I know I should be eating more vegetables and getting 8 hours of sleep every night. It's just, life gets in the way sometimes, you know?
I feel you.
But maybe that's the key, you know?
What do you mean?
Like, maybe those lifestyle changes really are the secret to reducing those migraine symptoms.
Interesting.
Maybe if we really focused on building those healthy habits, we wouldn't even need medication as much.
That's a really good point. It's definitely something to think about.
Right. It's all about finding that balance.
Exactly. It's not an all or nothing approach.
No. It's about making small, sustainable changes over time that add up to a healthier, happier you.
Well said.
Well, on that note, I think it's time to wrap up this deep dive into the fascinating and sometimes strange world of migraine visual symptoms.
Well, it's been a journey.
It really has. And I hope if you're listening to this and you're struggling with migraines, that you feel empowered to learn more about your own triggers, talk to your doctor, and really advocate for yourself and your health.
Yes, you are your own best advocate.
Couldn't agree more. Now, if you want to learn more from the brilliant Dr. Ronnie Banik, we highly recommend checking out her full guide, Eye on Migraine.
Yes, so much good stuff in there.
We'll include a link in the show notes along with that amazing video we talked about from the Mayo Clinic that shows those visual auras in action.
Yes, definitely check that out. It's really helpful to actually see what those auras look like because it can be so hard to describe with words.
Totally. And you can connect with Dr. Banik on social media and learn more about her work on her website. We'll link to all of that too.
Perfect.
All right, until next time, be well, everyone, and take good care of those amazing brains and eyes.